Hello everyone, Dr. Sunita Arora here, and once again I bring you greetings from JTS Medical Center, Dubai. Here at JTS Medical Center, we are all about empowering women with knowledge related to their health. In today's video, we are going to talk about something that can truly help you in your pregnancy journey, your fertile period. Many women around the world struggle with fertility issues, irregular periods, PCOS or hormonal imbalances. Understanding your fertile period can be incredibly helpful not only for those who are trying to conceive but also for those who are not ready for pregnancy and want to avoid an unwanted one. So let's discuss what exactly is a fertile period. Your fertile period is the time in your menstrual cycle when the chances of getting pregnant are highest. To better understand this, let's go over some basics. A typical menstrual cycle usually lasts between 28 to 30 days, though it can range anywhere between 22 to 35 days. The cycle is measured from first day of your bleeding to next first day of your bleeding. Ovulation is when the matured egg is released from the ovary, and this usually happens 14 days before your next period. So, for a woman with a 28-day cycle, ovulation generally occurs on day 14. Once the egg is released from the ovary, it is viable for about 2 days, during which it can be fertilized. Sperm, on the other hand, on an average is viable for up to 3 days. This means the fertile window is typically 2 to 3 days before ovulation and up to 2 to 3 days after ovulation. For a 28-day cycle, ovulation happens on day 14. So your fertile period is from day 12 to day 16. For a 32-day cycle, ovulation will take place on day 18. So the fertility period is day 16 to day 20. If the cycle is suppose of 40 days, ovulation will happen on day 26. So the fertile period will be from day 24 to day 28. So this formula works best for those with regular cycles. For women with irregular cycles or PCOS or other hormonal issues, this calculation might not apply. Stress and other factors like illness, lifestyle, they can also affect your time of ovulation. So it's important to be mindful of these variables. Now, there are certain signs to predict ovulation and your fertile window. There are several signs and symptoms you can track in your body to predict your ovulation and fertile period. First is basal body temperature, which is the temperature when you wake up in the morning before doing anything. If you track this temperature daily, you will notice a slight rise of about 0.5 to 1 degree Celsius just after ovulation. Using a special thermometer designed for this purpose can help you track and predict your fertile days. The next is cervical mucus. Just after your periods, cervical mucus is usually scanty. As you approach ovulation, the mucus becomes thinner, clearer and more watery, resembling egg whites. This consistency helps sperms travel and survive inside the uterus. Next is ovulation pain. Some women feeling mild abdominal pain or discomfort around ovulation. This is called miscellaneous pain and can signal that ovulation is near. There are other symptoms also many women experience, like breast tenderness, increased sense of smell and higher sex drive just before ovulation. Some women might notice mild swelling or sensitivity around vulva. Using technology to track ovulation these days, there are many ways to predict ovulation. Thanks to modern technology, you can use ultrasound, which is called follicular study, to monitor your ovaries, or use apps that calculate your fertile window based on your cycle length. However, while these methods are helpful, I always believe that being in tune with your body is the best way to understand your ovulation signs accurately. So why is it important to know your fertile period? Knowing your fertile period is crucial because it empowers you to plan your pregnancy more effectively. If you are trying to conceive, this knowledge can help you maximize your chances. On the other hand, if you are not ready for pregnancy, understanding fertile window can help you avoid the unplanned one. Pregnancy should always be a choice, not a chance. By tracking your cycle and understanding your body's sign, you can plan when you try for a baby or avoid conception. In conclusion, becoming aware of your fertile period can significantly enhance your ability to either conceive or prevent an unwanted pregnancy. Tracking your cycle, observing changes in your body, and using technology can give you a valuable insight of your reproductive habit. If you found this information useful, please like, share, and subscribe to stay updated on more health tips. And don't forget to leave a comment or ask any question if you have. I'll see you in the next video.